Hello, everyone, and welcome to today's webinar. This is the second in our policy and advocacy update for the lung cancer community series. My name is Brandon Leonard. I'm the Vice President of Government Affairs at LUNGevity Foundation, and really excited to be partnering with colleagues at the American Cancer Society Cancer Action Network, the American Lung Association, and GoTo for Lung Cancer again on today's webinar. Many of you may have joined us back in June for our first webinar in this series, so welcome back. And for those of you who are joining us for the first time, welcome. We're really glad that you found us. Before I ask my colleagues to introduce themselves, I just wanted to share a couple of housekeeping notes for you. First of all, we will be recording today's webinar, and we will share the recording in an email with everyone who registered for the webinar. We'll also be posting it on LUNGevity's website, and our partners here today may be posting it as well. So there will be opportunities to see the recording if you want to go back and catch anything that you missed, or if you want to share this with friends and colleagues who might benefit from it as well. The second thing that I wanted to note is we welcome your questions. We will have some time toward the end of the webinar to do some Q&A. So you can put your questions in the Q&A box at any time during the webinar. Please be sure to put those in the Q&A box instead of the chat, because we'll be looking for them in Q&A. With that, I wanted to give everyone a chance to introduce themselves. So James, let's start with you.
Yes, thank you. I'm James Williams, Jr. I'm Director of Federal Affairs for the American Cancer Society Cancer Action Network. Our goal is to seek evidence-based public policy solutions to lower the burden of cancer for everyone. And I thank everyone for taking the time for this webinar today.
Thank you, James. And Ranjana?
Hello, everyone. My name is Ranjana Kapil. I'm with the American Lung Association's federal advocacy team. So I work on a host of issues with Congress and the administration, including lung cancer, federal funding, et cetera. And the Lung Association is absolutely committed to defeating lung cancer and seeing a world free of lung disease. So really excited to be here with you all.
And Elrich.
Good afternoon once again, and welcome. I'm Elwich Proctor, Senior Director of Government Affairs at GoTo for Lung Cancer, and our focus is making sure that lung cancer, it remains a national priority. And for me, that means building partnerships, working with all of you as advocates, lawmakers, and leading advocacy efforts that you all can join in and participate to secure research funding and patient access to care. So welcome.
Thank you all. Really, all of us, the four of us, talk really often about our different policy priorities. We work on a lot of the same issues, and those are some of the issues you'll be hearing about today. So we really wanted to look for an opportunity to come together and provide some helpful information about what's happening in the policy and advocacy space, and give you some updates and also some ways that you can be engaged in this work as well. So with that, wanted to just briefly show you what we're going to cover today. The first thing is the budget reconciliation bill that passed last month. So James is going to provide a quick overview of what happened with the bill and what some of the key provisions are and what we're looking out for in terms of implementation. We'll provide some updates on the National Institutes of Health and specifically the National Cancer Institute, where things stand in terms of funding and other issues. As well, the same for the Centers for Disease Control and Prevention. Elridge is going to cover the congressionally directed medical research programs and where we are with funding and grants in that space. And then James will wrap up by talking about the U.S. Preventive Services Task Force, why it matters, and where we are with the USPSTF. And then, as I mentioned, we'll have some time for discussion and Q&A after that. So with that, I'll turn it back over to James to tell you a little bit about budget reconciliation.
Thank you, Brandon. Well, as many of you know, budget reconciliation, passed in the House. It passed on July the 3rd of this year. Congress passed the final version of the HR 1 the 2025 budget reconciliation legislation. Like many organizations, the American Cancer Society Cancer Action Network strongly opposed the bill's healthcare provisions, which the Congressional Budget Office estimates would reduce the number of people with health insurance by 10 million by 2034 through major cuts to Medicaid and changes to marketplace and other coverage. And many of the bill's provisions, right, are not happening right now, but they're expected to happen in the next year. And some of the major provisions of the law are that well, number one, it includes the largest cut to Medicaid in the history of the program. And five of these are: one, requiring all states to implement work requirements as a condition of enrollment in or continue eligibility for Medicaid coverage. That won't be implemented by January the 1st, 2027, although some states may choose to implement earlier through waivers. The second is charging cost sharing to Medicaid enrollees living barely just above the poverty line. And that will include required cost sharing for most cancer related care. And that's going to be implemented October the 1st of 2028. The third is requiring all states to redetermine eligibility for individuals enrolled by Medicaid expansion every 6 months. That used to not be the case, but now that could kick more people off coverage and ultimately cause more churning of people with fluctuating incomes in and out of the system. That's going to be implemented on January the 1st of 2027. The fourth is reducing the look back period for retroactive eligibility from 3 months to 1 month for Medicaid expansion and 2 months for, quote, traditional, unquote, enrollees. That's going to be implemented January the 1st of 2027. And finally, there's making many other changes that are going to cut federal funding to this vital program. That's going to force states to pay more out of their own budget on Medicaid, cut people in services, or cut other important programs to make up for budget funding shortfalls. And finally, there are three other key provisions. One is that it makes changes to marketplace coverage. Number one is it blocks access to marketplace plans for individuals unable to meet Medicaid work requirements. Number two, that's July the 4th of 2020 of this year. Number two is in auto enrollment in marketplace plans. And finally, it ends protection for recapture of tax credits. And what that is are individuals who receive EPTCs estimate their annual income for purposes of determining the amount of the tax credit. And what this does, it eliminates the cap on repayment of excess advanced premium tax credits. What that means is without EPTCs, many people just simply will not be able to afford taxes and their health care. And those are the results of the budget reconciliation bill. Bottom line is many of the bill's provisions aren't effective now, but they will become effective coming the beginning of next year. And that's when a lot of people will have those problems. But more importantly, the enhanced the tax credits are set to expire at the end of this year. And if those tax credits aren't reauthorized by Congress before the end of the year, we're looking at, as I said before, a total possibility of 10 million people not having access to health care because without the EPTCs, tax it's just going to be too expensive for individuals to be able to afford tax cuts. And so our hope is that we're able to get that passed before the end of the year. And as a matter of fact, we hope to have that passed by May of this year because actuarials just need the time to be able to make those determinations. But that's where we are with the budget reconciliation. It's kind of tough, and but we're all built for this fight. So that's what we have to keep fighting for as we move forward. And that's it. That's the budget reconciliation news that I have. Hate to be the harbinger of bad news, but that's the truth and that's the fact. But that's why we exist. We exist to try to make things better. Thank you, Brandon.
Thank you, James. And just to emphasize a couple of things that you mentioned, I think as folks are looking at what's ahead in terms of advocacy, you mentioned those premium tax credits that are really important for a lot of folks to be able to access insurance coverage. And that's something ACS CAN, and I know all of our organizations are advocating for that extension. And so that's one thing that I think folks can look for in terms of advocacy opportunities is making sure those get extended by the end of the year. And the other thing that you highlighted is there are a lot of provisions that all of us advocated against in terms of, cuts, particularly in Medicaid coverage. Um, and we continue to be really concerned about those. There is a lag in time implementation, so I think it's important for folks to know that that's not all happening immediately. And I think we will all continue to try to influence policy in that space as well to lessen the impact and hopefully reverse the impact of those cuts that have been now scheduled through that legislation. Great. So the next topic that we wanted to talk to you about today is getting into some of the funding issues that are really important for, I think, everyone in our community when we think about what's happening with research. And just to level set a little bit for folks who maybe aren't as familiar with the appropriations process, just wanted to make sure everyone knows that we're currently in fiscal year 2025. That ends on September 30th. And then fiscal year 26 will start on October 1st. And typically, we would, well, the deadline then for Congress to finish appropriations for FY26 is September 30th. We know that, at least in recent years, that very, very rarely happens. So we know already that Congress is going to buy themselves some more time, and they will pass at least one continuing resolution that will give them more time to work on their appropriations bills. And that could take us later into this year. It could take us into early next year. But we know that there will be an extension of that time that they're working on this. So we are coming up to the end of the current fiscal year when funding has to be dispersed for research and for programs, but also really focusing on what's going to happen for FY26. So for the National Institutes of Health, and then the National Cancer Institute, or NCI, is the largest institute of the National Institutes of Health. You've, I'm sure, seen that there has been a lot of disruption to grants this year. There have been a lot of policies, both temporary and longer term, that have been put into place by the administration that have delayed and in some cases caused the cancellation of grants. So this has been obviously very disruptive. There are a lot of different ways that has happened. Some of those have been grants that have been canceled because of the topic of the grant. Some of them have been canceled because of disputes with a particular institution. Some of them have been delayed while the administration was reviewing the grant process. We saw a few weeks back that the Office of Management and Budget, which is under the White House, actually briefly put a halt on all grant funding going out from NIH grants. That was quickly reversed after a lot of pushback from senators, including a number of Republican senators. And so we know that there remains strong bipartisan support for NIH funded research, and that's key to keep in mind. Now, for the FY26 appropriations process, actually, I'll just back up and say for FY25, we did end up in a full year continuing resolution, which meant that for most agencies and programs, they ended up with essentially the same funding level that they did in the previous year, FY24. That was the case for the NIH and the NCI. They had essentially flat funding for FY25. For FY26, the Senate Appropriations Committee recently passed a bill out of their committee that would provide, among other things, a small but notable increase for the NIH. And that's significant because we know that we're operating in a really, really tight and constrained budget environment right now. So the fact that Senate appropriators, in a very bipartisan way, approved this bill with an increase for NIH and NCI funding is definitely significant. The House Appropriations Committee has not yet voted on their bill. It's the Labor, Health and Human Services and Education bill that includes NIH funding, but that vote is expected to be in September. So that's something we're keeping an eye on, and we anticipate that that number will be lower than what the Senate has approved. And then the House and the Senate will have to come together in a conference committee and work out their differences. One of the things that we talked about on our last webinar was also the staff reductions that have occurred at agencies, including the NIH. And this has, happened in a couple of different cycles during the year. And this is something that continues to be a huge concern for all of our organizations, because there are fewer staff at these agencies who are working on all different components of the process. So when it comes to an agency like the NIH, the staff in place that interact with advocacy organizations, the staff who review grants, the staff who, support their grant review process, and the staff who support communications and administrative roles. All of these have been significantly cut. So this is definitely causing huge disruption to the medical research process. And it's something that we continue to raise with congressional members and with the administration. The other thing that I wanted to mention here is changes to the grant review process. There have been some structural changes within the NIH that have altered the process. There was also an executive order very recently that stated that there would be more involvement of political appointees in the grant review process. And that is something that, again, causes a lot of concern, because we want to make sure that grants are being reviewed by the people who have the actual expertise in that topic area to be able to make the best decisions about funding. So all of these, I think, I mentioned a lot of concerns, but I think that the good news, kind of the silver lining here, is that there is very much bipartisan support in Congress for NIH funding. Anyone else want to add anything on that topic? If not, we can move on to our next topic, which is to ask Ranjan to provide some updates on the CDC.
Yes, so let's talk about CDC, which is super fun. For FY25, we're going to start with that before we go into FY26. Congress passed and the president signed a funding bill that kept CDC funding level earlier this year. And normally that would mean dollars should just flow out to states and partners without any issue. And instead, as we have all maybe seen through the news, maybe through our work or through our personal experiences, that's not the case. There's been a lot of confusion, a lot of chaos, a lot of funding being turned on, off, the spigot just kind of constantly being turned on and off, right? And that's been really challenging for CDC to do their work. And most recently, the administration decided that they were, through a funding memo, just like they did with NIH, insert a footnote that was going to freeze funding for certain programs. That included the Office on Smoking and Health and the Chronic Disease Education and Awareness Program. Good news, Comprehensive Cancer Control Program, from my understanding, was not frozen. And so that meant staff were able to work diligently to continue getting FY25 dollars out the door so that states could continue their cancer control efforts, including lung cancer screening. Today, you guys are hearing breaking news. Today, we received confirmation that CDC has now got approval for its FY25 spending plan and that the footnote issue has been resolved. This is still, this is progress. This is really great news. We are still waiting on more final information, like all the budget tables, et cetera. But this is what we've heard from multiple sources. And that said, I'm going to still hold my breath until states actually get the money in their hand, especially for the programs that were frozen. But it's something. And, CDC isn't NIH. CDC doesn't have the same level of bipartisan love and support that NIH does. So that's why it took longer than 24 hours for this footnote situation to be resolved. But a lot of grit, a lot of work from you all, from partners, et cetera. We were successful in a really difficult time. So that's really great. But that doesn't negate the fact that there's been a lot of funding uncertainty, right? And on top of funding uncertainty, we've also just been dealing with a lot of staff reductions. And just this week, we did find out that HHS has confirmed that we're going to see a lot of CDC staff receive termination notices this week, about 700 employees, as part of a reduction in force. Where those employees sit in CDC, we don't know yet. We're going to have to wait to find out. There are certain branches, certain parts of the CDC that remain protected and that they can't let go of those people. But there's a lot of other parts of CDC that are kind of open for those reductions in force. So when we learn more, we will absolutely share with you all, especially if they are in any way touching lung health, lung cancer, et cetera. But the real concern here is, less staff means less capacity at CDC to deliver life-saving work. And this compounds the disruption that's really been caused by months of frozen and delayed funds. So CDC still, we've got a long way to go before we see it kind of back to where it once was. Now let's talk about FY26. As Brandon said, Senate is the only chamber that has acted so far on labor, health, and human services appropriations, right? That bill has not gone to the full Senate floor, so it's just been sitting with appropriators, and they believe to pass that on to the floor. That's amazing. We had strong Republican and Democrat support for this legislation that for the most part, kept a lot of CDC intact. It kept all of CDC actually intact as it was. It was a pretty strong rejection of the administration's efforts and proposals to dismantle, to restructure, to eliminate a lot of parts of CDC, including the parts that work on lung cancer. It maintains that part. That's really, really vital. It keeps that comprehensive cancer control program that all of us care about level funded. It maintains funding for other lung health programs that, we can all say are somehow connected to lung cancer. It also included really strong report language specific to lung cancer, reinforcing congressional support for early detection and treatment and prevention. Also includes really strong report language for the Chronic Disease Center. That's where a lot of the cancer work gets done under that big center, and really highlighting the importance of chronic disease as a way to reduce healthcare costs and improve population health. Huge. Super happy to see that. There was also really strong language that rejects administration efforts to reorganize or dismantle, like putting in new guardrails to stop maybe grant cancellations or sudden restructurings, really just trying to put in more writing than ever before. Hey, we've got processes for these things. This willy-nilly firing of people, but not telling us, or not letting funding going through to states or to partners and not telling us we want. So this was the Senate appropriators' way of finally standing up and saying, we're not okay with a lot of what's been going on. And this, in writing, we're putting it down. So key takeaways, FY25 comprehensive cancer control program was protected from the freeze. CDC staff are working on making sure all those dollars are trickling down to state cancer control and lung programs. Number 2, staff are still being cut at CDC, and we're still our public health capacity is still under threat. So we can't stop working on that, and we can't stop raising awareness about that. We have to. Number 3, FY26, the Senate has really protected cancer work at CDC, and they've stood up for lung cancer, and that's really important. And the House bill is going to be that next big test. And lastly, your role matters. Policymakers need to hear that cancer control programs, that chronic disease work, this is really essential, and that freezes and cuts and staff reductions really put our communities at risk and our health at risk. And we really need Congress to stand up for all of us. So that's what I got on CDC. Elridge?
Brandon, do you need to transition okay.
Oh, you're on mute, Brandon.
Sorry. No, Elridge, you can take it away to talk about CDMRP.
Okay, great. Brandon is our MC, so I defer to him. So let me just give very quick background for those who are new to this webinar. This is webinar number 2, just to recap a little bit about what CDMRP means and LCRP. So about 16 years ago, Congress created a dedicated lung cancer research program, that's the LCRP, under an account known as the Congressionally Directed Medical Research Program, that's the CDMRP. This is all done within the Department of Defense. So this program funds research focused on the causes, treatment, and prevention of lung cancer, but it does require annual funding through the appropriations process. So last year, thanks to the strong advocacy, we secured 25 million for this LCRP, Lung Cancer Research Program. Unfortunately, because Congress passed a continuing resolution that cut the account, the CDMRP, by 57%, lung cancer research received no dedicated funding this year being fiscal year 2025, FY25. That setback forced us to restart efforts to restore and increase funding. You heard an update from my colleagues about what's taken place over in the Senate. So last month, the House passed its version of the fiscal year 2026 Defense Appropriations Bill. That bill provides 700 million for the account, the CDMRP overall funding. But that's a steep drop from the 1.5 billion provided just 2 years ago. While the House did, and that's the good news here, it did preserve lung cancer research program as a standalone line item. It only allocated $15 million, which is well below the 25 million I mentioned that we secured last year. Now, looking at the Senate side, here's what happened there. The Appropriations Committee did advance the fiscal year 2026 defense bill, and it bundled it together with the bill that funds the NIH that you just heard about, Labor, Health, and Human Services Appropriations Act. And while this bill is an improvement over the president's budget, particularly by maintaining or only modestly reducing funding for research at the NIH, NCI, and CDC, as you heard from my colleagues, there is a challenge. The Senate does not dedicate funding specifically to lung cancer. Instead, it keeps lung cancer in the peer-reviewed cancer research program, where 24 cancers are forced to compete for just $130 million. So the bottom line is neither the House nor the Senate has proposed a funding level that meets the needs of the lung cancer community, but we do celebrate the small wins where we see improvement with funding for the other agencies, the NIH, NCI, and CDC, and we are happy about being retained as a line item in the House version of the bill, but none of this has been resolved. The fact is CDMRP had already endured a 57% cut, leaving lung cancer without dedicated funding, and in competition for research grants this year, the House bill does not restore those funds, and Congress has provided no justification for the severe reductions that are being proposed in fiscal year 2026. And so the bottom line is we can't stay quiet about this. We will continue to raise our voices until the very end or when Congress adjourns. And we do have a call to action, which is to continue to urge Congress to restore funding for the lung cancer research program and invest 60 million in the lung cancer research program as part of fiscal year 2026 appropriations budget. I'll just stop there and see if there are any questions or if my colleagues want to add.
Yes, I just wanted to add, Elrich, thank you for that great description of where we are with CDMRP. CDMRP is a very, very important program for the American Cancer Society Cancer Action Network. As you know, Elrich pointed out, you know, it's lung cancer, but it's many other cancers. We're talking about mesothelioma. We're talking about skin cancers, glioblastomas. I mean, the list goes on, but also TBI research, autism research, Alzheimer's research, among our, not just among our veterans, but this research ultimately helps everyone in the United States and ultimately in the world. And this research is not the research that's going on at CDMRP is not replacing or supplanting. It's not duplicative in NIH. this is research that's solely going on here for cancer. And if it doesn't happen here, it's not going to happen in all likelihood at NIH. So it's a very, very key and vital important program for all the cancers. We fight with, of course, lung and of course, all the cancers, but I cannot emphasize how important this program is for all of the cancers. I say that not just as an advocate, but I also used to work on the House Appropriations Subcommittee on Defense. So we all know how important this is. And thank you, Elrich. It's a great update. Absolutely.
Thank you, James. I'm just going to follow to say you raised a really important point, having shared what the updates are regarding the Department of Defense versus the other agencies. I just want to make sure that all the advocates walk away knowing that we will not allow members of Congress to pit one disease against another or one agency against another, because they are all equally important and they're all doing vital research. And we stand strong in advocacy for all of them. But I wanted you to have the reality of what's happening at this one distinct Department of Defense research program. So thank you for that.
Absolutely.
Thank you, Elrich and James. Yeah, that was a great overview. And as you all said, we're all going to continue to advocate to push for the highest possible levels of funding for the CDMRP and specifically the LCRP, for the CDC and particularly the cancer programs there, and for the NIH and specifically the NCI. We'll come back to a little bit of advocacy messaging in just a moment. But next, I wanted to turn it over to James again to talk a little bit about another topic that's very much very timely and very much in the news, which is the U.S. Preventive Services Task Force.
Yes, thanks, Brandon. So the U.S. Preventive Services Task Force, they've been around quite a while. How long have they been around, James? Well, in my selfish case, they've been around. I mean, when they were founded in 1984, I had been arrested a couple of times in front of the South African Embassy. And I know my colleagues get tired of me saying this. That was, in my case, 50 pounds in an afro ago. 1984. That's when USPSTF was founded. And USPSTF is an independent panel of national experts in prevention and evidence-based medicine. They develop evidence-based recommendations about clinical preventive services for primary care physicians. And these recommendations focus on screenings, behavioral counseling, and preventive medications, and apply to people without symptoms of a specific disease. And where does this all meet with Braidwood? Well, the Supreme Court in Kennedy versus Braidwood Management upheld the Affordable Care Act's requirement for insurers to cover certain preventive health care services without cost sharing. And this decision specifically addressed the challenge to the constitutionality of the USPSTF's appointment process and the Secretary of Health and Human Services authority to implement their recommendations. The court affirmed that the Secretary has the power to appoint and remove USPSTF members and can also review and potentially block their recommendations, effectively preserving the Affordable Care Act's preventive care mandate. But one big takeaway from that is that the Secretary, it's been determined that he can make those decisions as to who can be on the board and who won't be on the board. And the American Cancer Society's position, Cancer Action Network position, is very clear. We've sent letters that we have in the PowerPoint that we write to express our strong support for preserving the independent, scientific rigor, and nonpartisan mission of the U.S. Preventive Services Task Force. Because access to preventive care saves lives. I mean, over the past 4 decades, cancer prevention and screening services alone have averted about 4.75 million deaths from breast, cervical, colorectal, lung, and prostate cancer. And specifically to lung cancer, I mean, from colonoscopies that detect polyps to programs that successfully help people to quit smoking, to low-dose CT scans that catch lung cancer in its earliest stages. Coverage for preventive services enable access to less invasive, more effective, and lower cost treatments while significantly improving patient outcomes. And, one thing, federal law requires most private insurers under USPSTF to cover preventive services recommended with an A or a B rating, and those services must be provided at no cost to the patient, meaning no co-payments, no co-insurance, or deductible when delivered by an in-network panel. So, and the thing is that when we do know that out-of-pocket costs can reduce the number of people accessing preventive services, and eliminating cost sharing for colorectal cancer screening led to an increase in screening by about close to 6 to 7% in eligible adults with lower income and lower education. And nearly 1 in 3 people with employer-sponsored health insurance received no-cost preventive services between the years of 2018 to 2022. So, it's very, very important. And really that's kind of how they all come together with regard to USPSTF. And the current status is, along with many of you, we've sent letters to the members of Congress, and we joined in a letter with many of you on a letter to the secretary, asking for the independence and the evidence-based way in which USPSTF does their job is maintained. So finally, what's the current status? We're waiting. We're waiting to see what the next step will be of the Secretary of Health and Human Services. And we hope that the Secretary, in his wisdom, will preserve USPSTF, not just not just the current membership, but more importantly, if not the current membership, the evidence-based conclusions that have been used since 1984 to save so many lives. And with that, that's it for me, Brandon. And if there's
Great.
any questions for my colleagues, or if there's any more my colleagues would like to add, please let me know. Thank you so much.
Thank you, James. I think you did a great job of summarizing like what can be a really complex topic. Just understanding the role of the USPSTF and then where we stand now. I know a lot of us are really focused on the court case for a long time. Now we have the decision, but now we're also in many ways a favorable decision, but now looking at this new threat to the task force itself and its ongoing operations. So next, as we're coming to the end of our presentation, definitely want to continue to, I know some folks have put questions in the Q&A box. Please continue to do that as you think of them. But really wanted to close in terms of slides by emphasizing what everyone has talked about, and that is the importance of advocacy. I want to acknowledge it's been a difficult year, right? It's been a trying year, and a lot of the things that all of us really care about and have been pushing for, we've been playing a lot of defense this year, and that can be very exhausting. I know for advocates who are writing and calling their members of Congress and telling them it doesn't always seem like your message is getting through. But I do want to emphasize, you've heard, I think, from everyone today that there are really important pieces of the puzzle where the message is getting through. The message is getting through about the importance of investing in medical research, including in lung cancer research. It's getting through about the importance of programs at the CDC that support people getting information and access to services. And there is bipartisan support for this funding. And what I've always said, whether it was, several years ago, when people would sometimes ask, well, why do we need to still go up there? Because we've been getting all these great increases for NIH funding. They're just going to keep doing it. But as soon as we let our foot off the gas, that would have been when we lost momentum, because everybody else is up there talking about their funding priorities as well. This is a different situation, but it's still just as important, even more important for everybody to really keep pushing on advocacy. Those messages are getting through. They're getting through both in what you're saying and the volume, because they're hearing from thousands of people about how important these issues are. And I think that may not win over everyone. We know that, but we have to keep pushing because we know that we're making an influence on a lot of key members of Congress. So definitely want to encourage people by any method that you can, whether it's sending an email, making a phone call every day that you're able, sending messages through multiple platforms. We encourage it. We all have advocacy platforms. We all have covered, in different ways, the issues that we've talked about today. Use them all because there's no such thing as them getting too many messages about this right now. And we'll put those in the chat for you all, just so to make sure that you have those advocacy pages for our organizations. If you are able, it's can be very impactful to have an in-person meeting with the member or their staff. Want to emphasize the value of meeting with staffers because they're the ones who are issue experts for the offices that they work in, and they take the messages that you bring to that member of Congress. So this is still August recess. Would encourage you, if you have the opportunity, to meet in person with your congressperson's office. But continue also to make those calls and send those messages. Again, take advantage of the advocacy platforms that we all have with our organizations. I did see a question in here in the Q&A that was asking about other things that you can do beyond calling and sending emails. And I wanted to mention just a couple of quick things, and then I want to ask my colleagues to share ideas that they may have as well. One tool that can be pretty effective is getting op-eds, articles placed in local and state papers, because those have a way of getting the attention of the members that you are targeting. And the more that you can kind of focus it on their state or district, I think the better. So that's one thing that I would recommend. And let me just open it up and see if others want to add anything to that as well.
Sure. I can actually share that Lung Cancer Awareness Month is coming up, and that is such a great time for all of you to continue to share your stories. And as you prepare to build up for activities during the November Lung Cancer Awareness Month, it's important to track what's happening with the budget and the September timeline that Brandon offered initially when we began the webinar. And if at that time, Congress still has not passed a bill and we're under another continuing resolution, more than ever, your voices will be needed to add pressure so that we don't end the year the way we started it this year. Just from my organization, I just want to give a quick plug in that in the new year, we will be holding our advocacy summit again. We put out a save the date, March 1st through the 3rd in 2026. So for anyone who's never done advocacy work before, or if you're looking to do something more in person and would like to join us, our summit is free and it will focus on advocacy to members of Congress regarding budget reconciliations that may be still needed or the new year's budget. So I'll stop there. Thank you for the opportunity to share.
I'll chime in real quick and say, in addition to op-eds, letters to the editors are also really welcome. If you work with one of our organizations, just reach out to us and we can connect you with our marketing comms people. Those are the folks that would help with all of that. So that's really important. Don't just write and call. If they're home right now, go to a town hall, go to the district office, see if you can try to meet with them there. Or ask a question at a town hall, whether it's in person, whether it's on the phone. Those are other really important ways to be involved in the process. The other thing is, some of you may be living in a state where you're like, all my reps, super great on these issues. Like, I'm just calling to say thanks, keep it up, I want to do more. You probably have friends and family who are in states with members who maybe aren't as fond of CDC or NIH or some of these other issues that we talk about, right? Talk to them, call them, ramp up your own local base that you have of your community members, of your friends, of your family across the nation. So have those conversations. Those are really important. Empower other people in your network to and emailing, and also social media. Very important way that we're able to amplify a lot of our messages. A lot of us, once again, have teams that are responsible for that. And so if you engage with us or let us know that you're interested, we can get you those materials to make it as easy as possible for you to engage in that way as well, whether it's by posting your own links or your own X's or Facebooks or whatever, but even like sometimes we do video campaigns. So you guys taking a video of yourself talking about the importance of these things and allowing us to use those on different social platforms is really important because it's stories that make the big difference, right? It's not just stats and facts, which are also important, but it's real life storytelling that makes the big difference.
I just wanted to wrap up by saying add on to what my colleague said, and that is, look, this is all getting in good trouble. Sometimes, getting in good trouble isn't necessarily march. You don't have to march over the Edmund Pettus Bridge to get in good trouble. Getting in good trouble is those emails, those letters, as Rajana said, going to those those town hall meetings. That's important. One thing all of us have been, and I'm a 20-year Hill staffer, and that's definitely something that I know is that just because a bill is a good idea doesn't mean it's going to get signed into law. The only way bills get signed into law, the only way things happen because you make them happen. And that's how every one of us approach our task every day. We have to make it happen. When you go to someone's office, when you send an email, and when you thank someone, you're not just making a request, you're flexing your power. And what they want you to do is to stop flexing your power, to give up. You can't give up now. It's tiring. It's exhausting. Take a break. Watch a movie or something, but you have to continue to move the ball forward. As Dr. King once said, if you can't fly, you run. If you can't run, you walk. If you can't walk, you crawl. Right now, we're crawling. That's for sure. But we're still moving the ball forward. And it takes each and every one of us in order to make that happen. There's a proverb that says, a couple of bees don't bother you, but when you come in a swarm, that's when you start running for your life. That's what all of us have to do. We have to come as like bees in a swarm to make individual members of Congress do what they know they need to do, but they're not going to do just because it's a good idea.
Thank you all. Those were great responses to the question. I think I want to just briefly show some messaging. Again, this really echoes things that we've already talked about today. But in any of the opportunities that you have, whether it's in person, on the phone, via email, in an op-ed, in a letter, in social media, however you're communicating, the messages that we're trying to convey are protecting funding for the NIH, for the CDC, for the CDMRP, so that each of them can continue to support research across the continuum of lung cancer, and for the CDC to continue to support those programs so that people living with lung cancer can be protected from infectious diseases, and that so there is more information and more programming that will help decrease the burden of lung cancer. And then we also, for the USPSTF, we want to make sure that the message is getting across that we need to preserve and support the work of the task force because they're making important recommendations that help people get access to services like lung cancer screening. I'm going to stop sharing right there. We had a few more questions that I want to see if we can answer in the short time that we have. A few of these we've already answered. So I just wanted to highlight someone mentioned on here as well, the value of town halls. And I think Ranjana covered that really well. Those are excellent opportunities to really make your voice heard. There was another great question that was, or comment about the impact of stories. And certainly, I think the more that you can personalize what you're asking, the more effective it will be. Those are really what stick out to people. In meetings with congressional offices, we will talk about statistics. We'll talk about the burden of lung cancer. We'll talk about, particularly in that state or district, what the impact is. But what really makes the message stick is hearing a personal story of how this has impacted someone who's a constituent. So absolutely share your story. And I always say have a 1 minute version, a 2 minute version, a 5 minute version ready, because you may have just enough time to tell someone as they're on their way to an elevator or they're on their way out the door. Or you may have an opportunity to sit with them and actually share a little bit more. So I think kind of practice a little bit so that you're ready to share your story when you have the moment. Then we had, let's see, another question on here that I wanted to address. One was what our organizations are doing to educate Congress that cancer research is at risk. So all of our organizations are doing this in a lot of different ways. Part of that is going up to the Hill and having individual meetings with congressional offices. We do that as individual organizations. We do that collectively as part of coalitions that we're part of. One Voice Against Cancer is one of those. There are others as well, but we're having those kind of direct engagements with congressional offices. We are looking to engage advocates such as yourselves through various channels. And I'll ask if my colleagues have anything they wanted to add to that in terms of getting the message to Congress.
I will say that the American Cancer Society Cancer Action Network will be having our legislative summit in Lobby Day this September 15th through the 17th. And that's when close to 800 of our volunteers will be knocking on each and every door of the Congress to fight for funding so that we can make sure that, among other things, but that's our big lobby day. And since and all year long, I have to give big ups, as they say, to the American Lung Association and Go to Lung Cancer. All of us have been fighting this fight for NIH funding, NCI funding, CDC funding since January of this year. And we've been working in coordinated efforts to make that happen. But specifically with the ACS CAN, we're having our legislative summit and lobby day, but we have already been engaging our over 1 million volunteers to meet in district offices, to go to town halls, to write letters, to send emails, to do op-eds, to make sure that that our members of Congress know that this is something that's not just important for us, it's important for this country.
I'll just follow and just say, the results of the progress we have today is because of these lobby days or advocacy days. So as you hear each of our organizations advertise or ask you to please save the date to join us, it's really important to consider lending your voice to this. And that's a perfect way to not only hold a meeting, but sharing your stories with Congress in person. This is how we help them to see lung cancer, for example, as an urgent matter and a priority for them. Lawmakers will listen when they hear directly from constituents like you who are diagnosed with lung cancer or who may be mothers, fathers, sons, daughters, sisters, brothers, and people living with lung cancer or someone who has it, and particularly someone who can hold them accountable as a voter. So save the dates, join us.
And then I'll just chime in and say, there was a Q&A question of somebody saying, is there any high-level talking points, if you want to do this on your own or you want to involve your community? And I think all of us are able to provide that for you. The Lung Association is working on a web page that really is just going to outline the chaos of this year and then sharing some high-level talking points that people can use on their own. We do want that to be a public resource for everyone. Ours are going to be more broad to lung disease, more broadly, but everybody can absolutely take that and make it more specific to lung cancer. And I think the other thing, we've all said it in some capacity, but these efforts, whether it's making a phone call, whether it's joining a lobby day, we are all pushing a really big rock up a very steep hill, and it will take a village to get it all the way to the top. So participating in something once is amazing, right? Like it gives you the bug and you're like, great, I want to keep going. I want to keep going. And that's what we need. We want you all to be motivated, empowered to keep going, because this fight is not for the lighthearted, honestly. We have fallen down a lot, and we keep having to pick ourselves back up and keep pushing all together, individually, in community, in partnership. And so it will be because of all of the voices that we will find success together. There are ways to be involved with all of our organizations, whether it's through Hill Days, whether it's through action alerts or whatnot. Find those ways, and we are here to be that resource and guiding light for all of you. And
Thank
we
you
are
all.
here to listen too. That's the other thing. We want to hear from you. Like what makes sense to you? What was working? What was interesting? Versus what you're like, that wasn't really a great idea. We want to hear it all.
Thank you all. I know that James put the ACS CAN website in the chat. I added the Longevity Action Network, which is all of us have platforms to engage the advocacy community. So there's ours. If anyone else wants to add yours in the chat, please feel free. Definitely want to encourage you all to use those resources. Again, I think all of us have some talking points probably in different formats. But one thing that we've started to do with some of our action alerts is to include not just an email, but also social media. So if you wanted to do a post on X, as well as a script to help with talking points if you're calling a congressional office. So for a lot of our actions, we have those as well. And I see Orange and Ranjan have also put in links for their advocacy pages. So definitely take a look at all of these. Again, I don't think you can send too many messages or through too many platforms. So take advantage of all of those. With that, I know I'm sorry we're not going to get to all the questions today, but was there any closing thoughts from my colleagues before we wrap it up?
I just want to reflect really what first, Brandon, Rajana, and Elrich, thank you for being, and Allison, she's off camera, but she's part of the team. I want to thank everybody for their consistent support for ACS CAN and what we're trying to do to fight cancer. And also what Rajana made a great point, and as did Elrich, as my former boss, John Lewis, said, this isn't the fight we can't ever become disappointed and hateful. We must always remain optimistic and hopeful. This isn't the fight of a day, a week, a month, or a year. This is the battle of a lifetime. And as Rajana said, it's not for the faint of heart, but everybody out here who's watching this, you already know that we're ready to take one step toward what we need to do to to eliminate cancer for everyone. And thank you for your support.
Well, I'll just add my thanks to all of the advocates who joined us on this webinar and for those who wanted to, but were not able to. So thank you for your continued voice and joining us in advocacy. And a special thanks to Brandon for hosting us at Longevity, and as well to James from American Cancer Society Action Network and Rajana, American Lung Association. It's always a pleasure working with you all.
Thank you all so much. Well, we really appreciate everyone for joining us today. Again, you will get an email that includes the link to the recording. Please share it. We would love for other people to get this information as well. And we hope to see you on the next one. We'll let you know when that one's scheduled. We're looking at the end of the year, so probably early December. And we look forward to seeing you then. Until then, take care and take care of each other, and have a good evening. Allison, are you still there? No.
Well, I was
Are we
going
in
to
the
say,
speaker's box, or are there other people?
what'd you say?
Is it just us, or are there other people?
I don't know, but I was going to say thanks. I got to